Have you ever wondered if narcissism can be treated? Can someone with narcissistic traits truly change, or is it a lifelong struggle? Today, we're diving into one of the most misunderstood personality disorders, narcissism. Whether you're dealing with it in yourself or in a loved one, you'll want to stick around for this discussion. Today, we're going to talk about treating narcissism. You'll notice there are exclamation points and question marks in the topic because there are many differing views and perspectives on whether or how it's even possible to treat narcissism. So, in this video, we're going to discuss that. One of the big issues is that narcissism is majorly misunderstood. Most of the time, it's lumped into an extreme picture of resistance, demonstrative behavior, and grandiosity. However, the reality is that it's on a continuum, like all other disorders, ranging from mild to severe to extreme. In this video, we're going to unpack the concept of narcissism, the two types, and the question, can these individuals benefit from treatment? The big question is whether they can benefit and whether it can be done. So hang out, let's unpack it and explore what we can do. Don't forget to like, share, and subscribe, and please leave any comments you may have in the comments section. I encourage everyone to keep it positive and create a supportive environment for people who have a personality disorder or traits, as well as those who may have loved ones dealing with it. Let's get into it. Most individuals along the narcissistic spectrum do not seek treatment. I said most, not all. To understand this, we need to talk about the two sides of the same coin of narcissism. On one side, we have the grandiose type, and on the other, the vulnerable type. These are also called overt and covert narcissism. Both forms share characteristics such as self-centeredness, an exaggerated sense of self-importance and entitlement, disagreeableness, and a tendency to interact with others in an antagonistic way. The difference lies in how these traits manifest. The grandiose type is what most people picture when they think of narcissism. These individuals have an exaggerated sense of self-importance. They exaggerate achievements and talents, expecting to be recognized as superior without actually doing anything amazing. They're preoccupied with fantasies of unlimited power, success, brilliance, beauty, and ideal love. But if you ask them to describe that ideal love, it's often vague because if they're specific, they can be held accountable. They don't want that. Grandiose individuals believe they are special and unique, that they can only be understood by or should associate with other special people or high-status institutions. Middle-of-the-road stuff doesn't interest them because it doesn't allow them to bask in the reflected glow of superiority. They require constant admiration. I like to think of it as petting the kitty. You always have to go back and pet them, constantly giving them attention. They have a sense of entitlement, an unreasonable expectation of especially favorable treatment or automatic compliance with their expectations. Again, these expectations are usually vague because if they were specific, they could be held accountable. These individuals are often interpersonally exploitative, taking advantage of others to achieve their own ends. If there's a chance to trip you up to their advantage, they'll do it. Your failure becomes their success in their world. They lack empathy, often unwilling to recognize or identify with the feelings and needs of others. This trait is often confused with antisocial personality disorder. The difference is that antisocial individuals have a much broader lack of empathy. They're out for power and profit. For narcissists, it's about being recognized as special and unique. Both can be destructive, but antisocial personality disorder tends to be more so. However, there can be overlap, narcissists with antisocial traits and vice versa. It's important to tease these apart when talking about diagnosis and treatment. Grandiose narcissists are also often envious of others and believe others are envious of them, even when there's no evidence. They're arrogant, haughty, and tend to act snooty, especially towards people they see as beneath them. Now, let's compare that with vulnerable narcissism, the covert type. These individuals are defensive, avoidant, and insecure, wearing it on their sleeve. They're hypersensitive, always on the lookout for criticism or insults. They need constant recognition to bolster their sense of self-worth. They feel underestimated, which can lead to withdrawal and passive-aggressive attitudes in relationships. They have low self-esteem, tend to be solitary and detached, critical, and often see the world in a pessimistic, fatalistic way. They'll say, "No one suffers as much as I do," using their pain to shine and show how much they hurt. Now that we've covered both types, let's talk about treatment. There's a misconception that it's either possible to treat narcissism or not at all, but it's not that black and white. There aren't many research studies or effective treatments for narcissism like there are for borderline personality disorder. If someone believes they're perfect, whether they're grandiose or covert, why would they seek treatment? Their sense of self, even if it's a perfect sense of brokenness, is a coping strategy. Treatment challenges that, so they often avoid it. These maladaptive patterns are so rewarding for them that they usually don't seek help. When they do, it's typically after a narcissistic wound, something that fractures their sense of self, like being fired from a high-status job or losing a partner who elevated their status. In these moments, their ego is hurt, and they might seek therapy to repair it. But once that wound heals and their ego is stabilized, they often leave treatment early. They'll start exhibiting those covert traits, talking about how much they hurt, and might see a therapist. But once their sense of self is restored, they go back to their default maladaptive patterns and drop out. Despite the lack of large treatment outcome studies, there are a lot of clinical reports, case studies from clinicians, which say that narcissism is hard to treat and that treatments are often not effective. But one key to any success is building a strong alliance with the client, what I call speaking narcissism. You have to speak to them in a way that they hear and understand so they'll stay in therapy. If they do stay, we can help them learn adaptive strategies to meet their needs in a healthier way. For narcissistic individuals who stay in treatment, I've found that the core issues, guilt, shame, doubt, and feelings of inferiority, are the same regardless of whether they're grandiose or covert. Addressing these core issues can help lessen the severity of their narcissistic patterns, reduce disruptions in relationships, and help them keep jobs and stability in their lives. It is possible. I've seen success in my practice, but it's a long, slow, and challenging process. If you're someone who thinks you might have narcissistic traits, I strongly recommend seeing a mental health provider. Don't worry about the label, what matters is if those traits are causing problems in your life. With the right help, it is possible to learn healthier, more adaptive ways to cope. Thank you for watching. Please like, share, and subscribe, and leave any comments you might have. Take care.